Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And I wanted to upload this video for my fellow specialists, primarily because one of the biggest gripes that a lot of the specialists that we train to perform earwax removal is that with their previous visualization method, they really struggle with narrow ears, and that's because when they insert a small specular into the ear, and typically most of the specular that's commercially available is actually the smaller size, is bigger than this. So the specular size that I'm using here has that hole, you see, that opening from left to right is 3.5 millimeters. So the internal diameter is 3.5 millimeters, whereas most of this is around 4. And what they find difficult is when they've got a narrow ear and you're having to use a small specular, when you insert the instruments, the suction probe, because it goes through the center of the specular, it actually obscures partly the view of the wax. Now, with the WAXscope, we have an even smaller specular, so as I mentioned, 3.5 millimeter as opposed to the typical 4 millimeter. But in addition, we've got this slot, this opening on the roof of the specular, as you can see, between about 11 and 2 o'clock. And it's a Tomarkin style slot. So there's a specular that's been around for years that has a similar slot. And the benefits of the Tomarkin specular is that when you insert the instrument into the ear canal, you channel the instrument through that slot, which means the instrument is not having to go through the center of the specular and therefore obscuring the views. You can imagine if that suction probe went right through the middle and there wasn't a slot at the top, most of the view will be obliterated by the instrument. So this is where the WAXscope can really help treating your patients who have narrow ear canals. And I've cleared the occlusion. I'm just removing some matted dead skin from the posterior canal wall, and you can see how narrow that ear canal entrance is. It's almost shut. And once I remove all the surrounding wax and dead skin, I'm going to insert the speculate and I'm going to really stretch open this patient's entrance of the ear canal to get a full view. So at the moment you may be thinking, how am I going to visualize the eardrum? Because you can see the first bend there to the left, and the specular is actually not past that. So I'm just using the left hand side of the specular to open up that first bend, and then tucking in the right hand side of the specular past the second bend and straight in the ear canal. I can see that lovely view we've got of the eardrum. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.